Good morning, Mr. Jondo. I'm back. I've spoken to your doctor, so I want to give you the prescription and explain one or two things to you so that you can understand this prescription. Remember your sinus infection that you have, the congestion. So with the fever you are running, all those symptoms. When we collect, when the doctor has, we got some from those nasal discharges. So the doctor has looked at with the fever you're running. He has looked into that. He will need to recommend prescribe rather amoxicillin for you. Other people call it augmentin, 500 milligrams. You take it 3 times daily, morning, afternoon, and evening for 7 days. So when we start today, it will run till June 6, 7 days, 3 times a day. Okay, now this medication, okay, in your body, what it does, I will explain that to you. We call that pharmacodynamics. Pharma is from pharmacy. Dynamics is doing in the body, is action in the body. Then also I will not explain to you as what it does when it moves through your body, what it does in the body for the process of it moving through your body from your mouth to your kidney. Okay, good. So that is called pharmacokinetics. So let's start with the prescription. The doctor, which you know, Dr. Abbey, he prescribed amoxicillin, 500 milligrams. It's capsule, okay? It's capsule, easy to swallow, 3 times daily, 7 days. So the first thing that because you realize you are having, doctor has diagnosed you to be having acute bacterial sinusitis. Acute means it's just happening to you. Bacteria is the one causing it. Sinusitis means inflammation. That is, your nose is red, it's inflamed, something is making it to be burning up. Remember the way you're having those symptoms that you're having facial pressure, you're having nasal congestion, you're having fever. Good. So that's why you've been diagnosed with acute bacterial sinusitis. So amoxicillin, what the drug does in your body, is a better back-term antibiotics and antibiotics, like I told you. It works against bacteria. Okay, this particular bacteria is they form like wall. They gather together in your body. So this antibiotics will now break that wall. It will not let the wall be building up, getting big. It will break them down and split them. When it breaks them down, okay. So after it breaks them down, that's the process of the drug in your body. So as it travels from your mouth now, so what happens to the drug? The first thing that happens is it will get absorbed. When it goes down your mouth, in your small intestines, like when we eat food and the food is absorbed in our belly, in the small intestines. Okay, good. So when that food is absorbed, it will now go down into all the tissues and fluids in your body, even to your brain. But it has little quantity to penetrate your brain. Okay, yeah, and that's the way it works. Okay, and I want to explain to you so that you can understand. Then after that, when you go through the body and the tissues and fluids, you now go through your liver, because that's why it breaks down completely. We call it hepatic liver metabolism. Something metabolizes, breaks down, and splits. Okay, then after that, you now go through your kidney. After it has served the purpose so that your body can get it off it, okay, through the kidney. We call that like clearance. When you go to the store and you go to the area whereby some items they want to get it off it because maybe there's a new weather or they brought in some new clothes, so they want to get rid of the old one. They call it clearance. So it does clearance for you, because this medicine doesn't settle on the body like 1 to 1.5 hours. So that's why the process is quick. It works faster. Okay, so when you take this medicine and it goes through your body, passes out through your kidney, you might notice 1 or 2 things which we call side effects. These side effects can now turn to be, sometimes they can become problem. So they call it adverse reaction. That is, your body is now reacting to you. So one of the side effects which is common is you become nauseous. Like somebody wants to throw up or you throw up. Sometimes you might have diarrhea. You are passing loose stool, okay? You are passing this one. Sometimes you might have rash or skin irritation. Your skin become itchy, okay? And you have headache. So when this happens in your body, if the itchy, in case you are not reacting to that medicine, maybe your lips is swollen or getting bigger, or you are having kind of diarrhea, whereby it's producing bad smell. They call it C. diff. C. diff, like diarrhea that is very, 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 very stinking so bad. Okay, so in that case, it's reacting negatively to your body. Then you call your doctor or you go to the nearest ER. And in that case, you started having shortness of breath. You won't be able to breathe. Your lips is swelling up, okay? Your face is swelling up too, okay? And you might be having the diarrhea become bloody or a lot of water. You just keep having, keep coming up, and the skin rash is now spreading all over. Just go to the ER, okay? Please go to the ER. And these medicines, they work differently in kids and they work differently in adults, okay? The way they work in kids is kids they have little weight, so they use their weight to measure the kind of medication they give them. That's why they give you adults 500 milligrams, because you have big body, okay? Because you have big body, and in that case, in case also just like the adult, they give them in liquid suspension. So they will just drop it in their mouth, okay? And we also have to watch out for allergic reactions. If they are reacting to it negatively, if the body does not want the medicine, we have to watch for that too. And it's common in kids that you have diarrhea and diaper rash, which is very, very small, okay? But in older people, as we get older, our kidney ability to function decreases. It become weaker, okay? It's very, very strong. So the dosing, they adjust the dosing elderly people, okay? Then, and we have the risk of, we call it antibiotics resistance, that it will resist it. Our body does not want it, okay? That's why it leads to C. diff, okay? Also, in both age group, we must realize safety is very, very important. That is, you have to follow up with our symptoms, and if these symptoms get worse every time, okay? And remember, when you take this medication, remember, Mr. Doe, you have to take it every 8 hours, 3 times in a day. And if it causes stomach upset, take it after meal. Make sure you eat before you take it. And also, do not skip the dose. Make sure you complete the 7 doses, and store the capsules at room temperature, okay? Store it in a very cool area. And it means if you miss a dose, take it as soon as you remember, okay? And do not take it if you have any allergy to penicillin, okay? Or you have a previous severe allergic reaction, okay? Probiotics like yogurt, they are very good, or supplement. They help this antibiotic resistant diarrhea. If you can talk to pharmacists, you can buy it there, okay? And that's it. Thank you so much. And all this that I'm explaining to you, I'm gonna give this paperwork with you. And if you have any questions, my number is there. Call us and I will explain that to you, okay? Thank you so much, Mr. John Doe, and I hope to see you again. Bye-bye.